Welcome to the second episode of Data Redefined. I'm super excited and humbled to introduce Beth Ann Lopez, the founder and CEO of Outfox Health. It's a tech company that uses AI to demystify health insurance coverage and pricing for Americans. This is something that we all have been looking for and we continue looking for in the industry. Beth has a very interesting background. Prior to Outfox, she founded DocuSan, a digital health startup in Vietnam that reached over 5 million users. Her work has been featured in the British Medical Journal, NASDAQ, the World Bank, and a Harvard School of Public Health case study. She's also a World Economic Forum technology pioneer. She holds a BS in biochemistry from the University of New Mexico and a master's of public health from Harvard. But it's so great to have you here today. What I'd like to start with, your journey has been very impressive, very different. I'd love the audience to hear that journey from you. Tell us how you started in this as a founder, not in the US, but outside the US.
Yeah, absolutely. So I never thought I would be an entrepreneur. I've always been passionate about healthcare and access to healthcare. And I guess it kind of started from in undergrad. I was set on this path where, I thought I was going to go to medical school, took the MCAT, was kind of ready for that path. But I also wanted to kind of get out and do something different. So I'm from New Mexico. My family's lived there for generations, and feeling a little bit cooped up. And so I joined the Peace Corps. And back in those days, they didn't let you choose which country they would send you to. And so they randomly sent me to Cambodia. And so I worked in a village in a really remote area for 2 years. And I thought it would also look really good in a medical school application. And, it would just go smoothly from there. But it actually really changed my perspective because it made me realize that there are so many things that prevent people from accessing good healthcare that go so far beyond just whether a doctor is present or not. There's problems with health systems, there's problems with policies, bigger systemic issues that cause poor health. And so that ultimately drove me to pursuing a career in public health. I went and got my master's. I thought I would actually go into like health policy. And, but after that, I ended up doing some work with in the development aid industry and realized that I am not a good fit for government. It's very bureaucratic. It's very hierarchical. I was in my 20s at that time wanting to, make a difference. And it just it wasn't the right kind of like pace for me. And so I ended up joining a pharma tech startup that was based out of Singapore, and they wanted to expand to a bunch of different countries in Southeast Asia. And so they hired me to help them. So I helped them launch in Cambodia and then into Vietnam. And I was just amazed at how quickly tech could impact people. So we launched this like social network for pharmacists, and then within months, like thousands of pharmacists had downloaded it and started using it to talk to each other. And I was like, man, this is incredible impact in such a short period of time. And after the experience of launching this platform from zero to one in these different countries, starting a team and getting partnerships started, I realized if I can do this for someone else, I can do this for myself. And so I ended up quitting my job at the startup to ultimately start my first company, which was a healthcare marketplace based in Vietnam. I love Vietnam. It's like 100 million population, very tech savvy and growing, but a lot of like problems in healthcare. And the problem that we were addressing with this first company was that all of the doctors and clinics were offline. So you had to use word of mouth to know what your options were. And so we signed up thousands of hospitals and clinics across the country, got doctor profiles so you could compare them based on like their prices, because in Vietnam they would actually display the prices at the clinic. It was not so difficult to get. And then also like patient reviews. So it was this kind of like healthcare access and transparency play. And we helped over 5 million people access healthcare through that platform. But we always had this kind of interesting issue in which no matter how much information we gave to people or how good we made the UX, they still needed more help. And so the most popular feature in the whole platform was always our customer service. It was people wanting to call or chat in and basically get some more like personalized help, because it's so hard to know in healthcare what you need in the first place. Like, how do you know if you need an endocrinologist or rheumatologist, or should I talk to my PCP? And then how's my insurance going to factor into this and the cost and all of that? And so healthcare navigation as an industry has typically always had humans in the middle that are just helping to overcome all the gaps in the health system that aren't patient friendly and help to overcome that information asymmetry between the patient and the doctor or the patient and the health system. And so I moved back to the US in 2024 after selling that company. And I was really excited about two things in particular. One was generative AI as a technology, because I see it as something that can solve one of healthcare's deepest issues, which is that information asymmetry. If you're using a chatbot, you can understand your 100-page plus insurance policy document in Spanish at 2 a.m. perfectly, patiently. And that's something that never exists before. And then the second thing was the transparency and coverage rule that went into effect in 2022 that mandated for the first time ever that every single hospital and every single insurance company in the whole country had to publish their full service price list for the first time. And so you would think we would have price transparency in the US now and be able to get costs down, and people wouldn't have to worry so much about going in debt or avoiding care because of the costs. But that's not the situation today. And so that's kind of how I ended up starting my first company, and then what led to us creating Outfox.
No, that's excellent. Why don't you tell us a little bit about what Outfox does? Because it looks like your common theme is purpose-driven healthcare for people, for the masses, right? So I can see that common thread even with Outfox. Why don't you describe what Outfox does?
Yeah, so Outfox is a co-pilot that helps people to actually understand how your insurance works, what it covers, what it doesn't, all the different benefits and things that you're already paying for, and you can make the most out of them. And then, most importantly, we help you to know what your options are in terms of price and quality of healthcare providers. Because in the US, like most countries, there is no correlation between price and quality in healthcare. You can go to a fantastic hospital that is charging 1/10 of the price of a neighboring hospital, and get for the exact same thing and just pay so much less. But as consumers, we don't have access to that information. Like, when is the last time someone really told you how much healthcare was going to cost before you went, right? There's no easy way to actually do those comparisons. You would have to spend hours, calling the hospital, hoping they would, actually give you the prices of these different things, and that's just not the reality today. And so we have this big market failure, because if we can't be informed consumers, the same way that we would compare, anything on Amazon, you see the reviews, you read about the prices, you can, that's how we get market efficiency. It's totally missing in healthcare. And so what Outfox does is we basically take this price transparency data and we democratize it. So in the past, you had to be a large insurance carrier or big hospital network to make sense of these huge price transparency files. But we use AI to make them understandable to anyone.
Got it. No, that's really good. And you seem to be effectively using AI and Gen AI. Is this AI or is this Gen AI? Is this agentic AI or a combination of all three?
It's a combination of all three. And so, like, part of our system uses a retrieval augmented generation, because what we do is we take and process all of your different healthcare policies. So, those like horrible summary plan documents that are over 100 pages and written in legalese. We can make those like understandable. And then we also have agents within the platform that execute different tasks. And so you can ask the AI, like, according to my insurance, how much do I have to pay for like a knee surgery? And then what the agent will do is it will autonomously predict the billing codes associated with that query. It'll then go into our backend database using the vector search and actually look up the real negotiated rate with your insurance and how much it would cost. Then it would also call in our RAG system to let you know you're out of pocket based on your benefit design. And then it would show you the profiles of the different hospitals and what options you had. So it's a combination of the three.
No, that's outstanding. So there's a lot of hype in the agentic AI space today. And then combine it to the fact that recently MIT published this report about 95% of pilots actually failing or not realizing any P&L impact. It looks like your solution or your product actually will impact customer experience or patient experience and P&L impact also for individuals, but then also the employers. um, and you're doing it in a very effective manner, leveraging agentic AI. Based on your experience speaking to customers, what's hype? What is reality? What are the barriers that we'll have to think about?
That's such a good question because there's so much hype in this industry. And so the MIT paper was really interesting because it highlighted that about 70% of Gen AI budgets are going to sales and marketing. And so we've all seen those ads that say, stop hiring humans, right? But if anyone has ever received a cold email from one of these AI sales development representatives, you know that these are terrible. If anything, it is making you less likely to ever want to open your email again because you're just receiving like pure spam, right? And so these are like really flashy use cases. And I think a lot of but it appeals to people's, it's appealing, right? You're saying, hey, replace humans. Our biggest cost is payroll. What if you didn't have to hire all of these like SDRs, right? But in practice, it's not delivering. And at the same time, that paper also highlighted that 90% of employees are using ChatGPT or Claude at work. So Gen AI is like helping people, but not in the way that I think it's like currently like being advertised, especially by these like really hyped up companies. I don't think that like real good AI use cases are the ones that are directly meant to like replace people. I don't think it's anywhere near effective as that. I see Gen AI at its best as being able to augment human intelligence, right? And so I think like some of the best use cases are when we're deeply embedded in workflows, right? We're automating things that we're already doing, but we're just speeding humans up. So like in Outfox's case, if you were to try to figure out how much healthcare costs, you would have to spend hours calling a bunch of different hospitals, or you'd have to spend a lot of time finding the PDF of your insurance document and kind of like reading that, and it would take forever. Outfox just takes that process and reduces it down to seconds. And I see those as the most poignant use cases as well.
Would you also say the embedding these use cases in a way that actually also reimagines the way you interact with technology, the way you interact with the world, right? Not trying to just automate what you already have, but think about the overall experience and then the role that AI can play, and then fit that use case within that reimagined experience itself.
Yeah, absolutely. And I think like when people save time on not doing the kind of like repetitive, annoying stuff that we have to do, it frees us up to think about, higher level things, to be more creative, to come up with new possibilities because like we're essentially, I mean, they have this like saying in healthcare, you want to practice at the top of your license. And so if you're a nurse, like, you don't want to be answering questions about like, oh, what is a deductible? And like, what is like this health insurance term mean, right? Like you want to be at the patient's bedside taking care of them,
Yeah.
right? And I think this can be a pitfall in healthcare too. Like there was massive backlash against Hippocratic AI when it said that it was releasing these AI nurses, and it was kind of like pitching itself as like being able to replace a lot of nurses, and it led to protests even. And I don't think that's the right way to go about it. I think like we should be automating the annoying stuff that the nurses have to do so that they can focus on the real things. I actually don't think you can replace nurses at all. Like, I mean, when you wake up after anesthesia, your nurse is the one there, she's like holding your hand and stuff. I think, it's going to enable us hopefully to, focus on the more human and creative things actually.
Yeah, and there was a use case that we did for a client where it actually helped a doctor actually expand the number of patients they could see, because you're taking away a lot of the lower end tasks that they were doing, or like the care that that patients wanted only from them, but they could actually give it off to a combination of a nurse with an augmented AI solution with them, right? I can see that happening. Do you see adoption barriers because of data itself?
Oh my gosh. Yeah. In healthcare, there is so much information blocking. And it's actually for certain types of businesses, part of their business model. This has been something that has been like really shocking to me since, kind of moving back to the US is just the degree of information blocking that happens. And so, like, for a couple of examples, so most people in the US, like we're getting healthcare through our employers, meaning that our employers have to allocate some funds, and whenever their employees go and get healthcare, they'll actually pay for it. Um, but they rely on third-party vendors to help them administer these healthcare like insurance programs. And so if you've ever worked at a big Fortune 500 company, maybe you got an insurance card that said Blue Cross Blue Shield, but probably it wasn't actually Blue Cross Blue Shield paying for your healthcare. You're basically renting the network of doctors from Blue Cross Blue Shield, and then they're also administering your claims and doing all the admin. And so you would think that the self-funded employers, because they're the ones that are ultimately paying for it, they should have access to the claims data so that way they can see how much are we actually paying for healthcare, where are employees going, how can we kind of get a handle on costs. But these large carriers and sometimes third-party administrators will make the employers go to lengthy data request processes that take months before they'll actually give them raw claims data. Or sometimes they'll even charge a fee to charge them to access their own data, which is crazy. Or what they do too, also kind of like egregiously, especially in the pharmacy benefit space, is they'll strip the data of key fields like provider identifiers, negotiated rates, and these kind of things. So, okay, here we gave you the data, but you can't actually use it to figure out how much anything costs. And so this is just a really widespread practice. And yeah, I mean, it's, I think it's like pretty horrible. And then there was also like very wide lobbying too when it came to passing the transparency and coverage rule. Like the American Hospital Association said that, oh, knowing the prices of these things is impossible. And then the American like health insurance group said that price disclosure would confuse consumers and harm competition. So it's like, are consumers too dumb to know the price of healthcare if you gave no, I mean, like, they benefit from this because basically, large hospital systems they want to charge more for healthcare because that affects their P&L. But the large insurance carriers too also benefit from this opacity because since the Affordable Care Act went into place, they passed something called the medical loss ratio that states that large insurance carriers can only take about 15 to 20% of like all of the premiums they charge for admin and profit. And so if you want to make a big profit of something, 15% of a large number is a lot more than 15% of a small number. And so a lot of the times they use even the price transparency data to do strategic contract negotiations with the hospitals, and they both want to get the price of healthcare up. And so meanwhile, the poor employers and ultimately us, consumers, because this is coming out of our paychecks every single month, we're the real payers here, don't have access to our own data, and we don't have the ability to get a handle on costs. And I think that this is something that is wrong. And so, I mean, that's the whole reason that Outfox exists, is to overcome these information asymmetries, to arm consumers and the employers paying for their healthcare with the same level of insights and data that a Fortune 50 company would have access to.
Right. When you try to implement these solutions in your customer base, what are some of the other, one is, organizational acceptance and so on, but then the technology barriers. What are some of the typical ones that you encounter?
Yeah, so I think this is actually like one of the more clever things that Outfox has done is that we don't require really deep integrations with your third-party administrator or your carrier. What we take advantage of is, I mean, like legislation, right? So the transparency and coverage rule forced every single carrier to publish their rates on the web publicly. It's on the web in public, but that doesn't mean it's easy to understand, right? These are like multi-terabyte JSON files. You have to have a whole data science team to clean, parse, and structure them. But we get those. And so it doesn't matter which carrier you're working with, which health plan that you're on. If all we need is like the PDFs of your insurance documents, which everyone has, and then we go and we actually find that transparency data and make it so you can plug and play. So you can't hide from us. We've got the data already.
That's excellent. And you work both in Asian countries and in the US right now. What surprised you throughout this journey as we wrap up this discussion?
Yeah. Well, I guess like one was like just the overall degree of like information blocking and things that had happened. I thought that, well, kind of in Vietnam, we were starting with just a lot of the hospitals and clinics being offline, but then moving to the US and just kind of like realizing that, hey, this is actually like baked into the business model. We had gotten a meeting, and this is like a really big deal for, a small early startup with a stage startup like us. But we've gotten a meeting with a really senior executive from one of the country's largest health plans. And, back then we thought it was like, hey, maybe we can sell to the health plans. And, they would also be interested in cost savings because we had seen that, some of them had like their stock prices went down because of like their medical loss ratio. And we're like, oh, surely they would want to get these costs down. They only want to get the cost down for the public programs like, Medicare and Medicaid. Commercials, a different story, as we learned. But I was doing a demo of Outfox, and I was showing, how we could reduce like call center burden, answer a lot of questions, offer a better member experience, reduce admin. And these were all resonating, going really, really well. But then when I showed the price transparency features, this executive said, oh, our members don't really care about the price of healthcare. And I was just like, what do you mean people don't care about the price of healthcare? This is like on the top of everyone's mind. It's yeah. And so I kind of left that meeting like a little bit perplexed. But then, it led me down this rabbit hole that kind of showed me all of the kind of like entrenched interests and conflicts of interest within the industry. And it helped us to align with, who ultimately became our end customer, which is the
Yeah,
self-funded employers.
yeah, yeah. No, that's very interesting. And, as a consumer, I can completely relate to saying, it's a complex field. Just navigating the healthcare system and knowing what you're expected, what to expect as you go through any healthcare challenges. Thankfully, I've not had to experience that part of it. But then, what you're doing is very inspiring. The journey that you've taken and the fact that you're trying to bring cutting edge technology to a field that actually really requires it, and for consumers who really will benefit out of it. This was such an enriching conversation, Beth. Thank you so much for your time.